Hello everyone, welcome back. Today we will discuss about a woman with watery diarrhea. Here's the MCQ. A 60-year-old woman had voluminous watery diarrhea sometime after extensive surgery, radiation and chemotherapy for pelvic malignancy. Examination demonstrated pseudomembranes covering her colostomy. Stools obtained through her colostomy demonstrated Clostridium difficile toxin type B. We asked about the main precipitating factor leading to the causative infection is likely to be A. Immunosuppression, B. Hypersensitivity to antibiotic treatment, C. Short bowel syndrome, D. Radiation injury to the colonic mucosa, E. The use of broad spectrum antibiotics. I hope you are now used to my system. So what's the first step? Yes, as the first step we identify and underline the main keywords in this MCQ. So what are the keywords you can identify? Here I have highlighted the main keywords. Obviously 60 years old woman, she's an elderly person, voluminous watery diarrhea and extensive surgery, radiation, chemotherapy, and the important keyword here is pseudomembranes and Clostridium difficile toxin type B. Identifying these keywords, you may come to diagnosis, and we asked about the main precipitating factor leading to her watery diarrhea. Before I give you the answer, we'll discuss the case scenario further. So this is the sequelae here. Broad spectrum antibiotics like ampicillin, lincomycin, clindamycin and cephalosporins, they disrupt the normal bacterial flora in your gut, and due to that there's an overgrowth of Clostridium difficile, and the Clostridium difficile can produce two types of toxins, toxin A and B. Toxin A, it alters the fluid secretion and enhances inflammation and also induces post-capillary venules to leak albumin. But keep in mind, the dangerous toxin is toxin B. Toxin B is known to be like about 1000 times severe than toxin A, and it damages and exfoliates superficial epithelial cells of your gut, and that results in formation of a pseudomembrane in your colon. That's the term tells like pseudomembranous colitis. Now we'll get back to the MCQ again. So we are given that the colostomy demonstrated Clostridium difficile toxin type B. So it's a more severe form. So let's look at the answers. Immune suppression, this is wrong because the malignancy is not at its active state, because we are said as sometime after extensive surgery, radiation and chemotherapy. So this is not the correct answer. Hypersensitivity due to antibiotic treatment, it usually doesn't manifest as diarrhea. Short bowel syndrome is defined as the inability to maintain nutritional fluid and electrolyte homeostasis while consuming a normal healthy diet following a bowel resection. Of course, it can lead to malabsorption diarrhea, but here we are clearly given the classical history and we are given the diagnosis such as pseudomembranous colitis, and they have found Clostridium difficile toxin type B. So obviously this is not the correct answer. And radiation injury to the colonic mucosa, yes, they can have diarrhea, but not the best answer here. So the best answer here is the use of broad spectrum antibiotics. As I told you earlier, many types like cephalosporins, ampicillins, these broad spectrum antibiotics can cause pseudomembranous colitis. So that's all for today. I hope you understood this MCQ. Please make sure to subscribe my YouTube channel for more important MCQ discussions like this. We'll meet from another MCQ like this.